Hello, my name is Dr. Dewan S. Raja. Today I will discuss about fracture of clavicle. Clavicle is also called collarbone or beauty bone. The clavicle is one of the most commonly fractured bones. It is more common among the children, but any age group may have clavicular fracture. It is caused by fall on the outstretched hand. An indirect force passes through the bones of the forearm and arm to the shoulder. It may be caused by direct fall or violent impact on the shoulder. The weakest point is the junction between the medial 3/5 and the lateral 2/5, where the anticurve and the retrocurve meets. After fracture, the medial fragment of the clavicle is elevated by the pull of the sternocleidomastoid muscle, and the lateral fragment drops down by the weight of the upper limb by gravity, despite attachment of the trapezius on the lateral third of the clavicle. Okay, so if you look at the anatomy of the clavicle or collarbone or the beauty bone, this is the clavicle. It has curvature, lateral 2/5, medial 3/5. This is the joining of the two curvature, and this is the site of fracture here. This is the acromial end, this is the acromial end, this is the sternal end, and we have some important muscular attachment like the trapezius insertion, deltoid anteriorly, lateral 1/3 posteriorly is the trapezius anteriorly deltoid. Here we have the pectoralis major, and above superiorly we're getting the insertion of sternocleidomastoid muscle. Here, this is the origin of the pectoralis major muscle. Okay, we got that. Here again, deltoid origin, pectoralis major muscles origin is here. This is the origin is here. This is the insertion of subclavius. This is thin muscle, actually protect the underlying structure, and this is the insertion of the trapezius here. Okay, so this is subcutaneous bone, horizontally placed in most cases, and here maybe the site of fracture, but any part may be fractured depending on the impact of injury. Okay, so this is the fractured clavicle here, and lengthening of the clavicle is shortened because this part is elevated by the action of the sternocleidomastoid muscle. This part is going to be depressed by the weight of the upper limb by gravity, and by the action of pectoralis major, this piece is drawn medially anteriorly by the adductor action of the pectoralis major. This is normal shoulder. This is the head of the humerus. This is the tip of the coracoid process, acromion process, acromioclavicular joint. This is the clavicle. These are the ribs. This is scapula. Okay, we got that. Now, the strong coracoclavicular ligament prevents the dislocation of the acromioclavicular joint. A patient with a clavicular fracture on one side usually present to the doctor by supporting, or the healthcare professional by supporting their sagging limb by the other limb. So if this is fracture, people hold this and go to the doctor. The lateral segment is often driven medially by the pectoralis major, medially, internally, and anteriorly. The fractured clavicle is usually shorter than the normal clavicle. Clavicle of the newborn may be fractured due to difficult delivery, like cervical or like shoulder dystocia. Okay, there may be fracture of the clavicle in difficult delivery, like that of shoulder dystocia. A child may develop green streak fracture. One side there will be fracture line, other side of the bone may not has no fracture line, and the bone is carved. That is called green stick fracture, like the plant, like the tree branches. Okay, so green stick fracture in children. Fracture of the clavicle, clinical feature, certainly clavicular deformity. There will be bumping at the site of fracture. If it is open fracture, skin may be discontinued. Bone may even come out. Swelling and ecchymosis, there is collection of blood under the skin. Hematoma, blood collection, big mass of blood collection, and certainly restricted movement. Possible complication, damage to the subclavian vessel because they are going underneath the clavicle, and certainly there is chance of damage to the brachial plexus that is formed with the root of the neck and goes under the clavicle to the axilla. Hemothorax, collection of blood in the thoracic cavity. Pneumothorax, there will be collapse of the lung and there will be air collection in the thoracic cavity, and there may be thoracic outlet syndrome because of fracture of the clavicle. Diagnostic test, plain X-ray in different direction, and it is very easy to pick up clavicular fracture by plain X-ray. Chest radiograph to rule out pneumothorax and hemothorax. CT scan to identify any damage to the subclavian vessels and the brachial plexus. CT scan is important. Now I'll go to the treatment. A fractured clavicle usually heals by 6 weeks. It depends on multiple factors. In a young person, it may be 5 weeks or 6 weeks. In an old person, it may be delayed. Person who smoke, who has malnutrition, it may be delayed. Consultation with orthopedic surgeon, with an orthopedic surgeon, is a must. So we must consult with an orthopedic surgeon. Non-separated fracture needs only immobilization with a sling. A displaced fracture is treated initially with immediate reduction and figure of 8 brace. That will work in many cases. A grossly displaced fracture, comminuted fracture, multiple pieces of bone, or there may be some type of jagged piece in between two big bone, two big fragments. Open wound fracture, injury to the underlying blood vessels, nerve, require exploratory surgery and fixation. Usually surgeon fix the fractured part, clean it, and certainly sometimes they put the plate and screw. Okay, that's all about the fracture of the clavicle. And this is my book for you, Upper Limb Anatomy Tutor, Anatomy of the Superior Extremity, available in Amazon in paper as well as electronic format. If you have any chance, you may collect. Okay, and these are my references. Again, that's all about the fracture of the clavicle. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.